Just days before the coronavirus pandemic exploded in the face of the world, there was a tele-series that came out called The Pandemic. If you've seen this on Netflix, you would have figured that it's eerily similar to what's happening. It almost seems like a news show talking about the situation in the world at present, whereas in reality, it's about a fictional account. The entire disease outbreak hadn't started when this series came out, and therefore it's very eerie to see what's being said in the serial and then to compare and contrast this with what's happening in our lives right now. Joining us on this broadcast from New York City is Dr. Syra Madad. She is a senior director of the system-wide Special Pathogens program at New York City, and she's responsible for the public hospitals in New York, and she features very prominently in this tele-series, and she's supposed to prevent the outbreak from happening, which is what she did in the series and now having to do it in real life. Just take a look. So in a month, the vaccine can spread across the world, which is exactly what happened, which doesn't sound so unbelievable right now, but imagine all of this having been made just weeks before this pandemic blew up in the face of the world. Dr. Syra Madad, an American pathogen preparedness expert. She runs the Special Pathogens program at New York Health Hospitals. She's joining us on this broadcast live from New York City. Dr. Syra Madad, welcome to India Today. I want to first start by asking you to compare the role that you are playing out in a tele-series vis-a-vis what you're having to now do in real life. It almost seems, as I see this, and so do people in India and elsewhere, that you almost preempted what would happen just days before your serial actually came out.
Well, it's not surprising, unfortunately. We know that this is something that was going to play out. We just didn't know when or how or where. And the reason why we knew it was because we live in a world where there's over 7 billion people, and we have all of these different factors that essentially influence, the uprising of these types of epidemics. And this is not something that is new for us. We've seen different epidemics play out, throughout history. The most recent in the past, 6-7 years, you can think of Ebola. So Ebola came around twice, 2014, and now again in the DRC. You probably remember Zika and measles. So these are all various epidemics that we've recently faced. And one thing that we've learned from all of these epidemics is that they are inevitable. They're going to continue to rise. They're going to continue to wreak havoc unless we are prepared. Our response right now has always been, focused on the individual disease itself and then addressing that individual disease. We are not addressing the underlying processes that enable these diseases to essentially start. And when I say these processes, it all, boils down to epidemic control, healthcare system capacity, and then looking at the different processes that we have and infrastructures and systems that we don't have in place around the world that we need to make sure that we have and that they're strong, because we're only as strong as our weakest link.
So you're essentially saying that for people who are in the business of virology, epidemiologists, experts could have anticipated that the situation would be just the way that it is. Now, from what I figure, you've got best case scenarios, you've got worst case scenarios, you've got baseline scenarios. Before I get to India, when you look at what's happening globally, is this a worst case scenario playing out? Do you think that the world is actually quite lucky that from what you'd been preparing for, the strain of the virus that we're dealing with, the coronavirus, COVID-19, isn't actually that bad?
Well, the outbreak itself is still, gaining more and more momentum, and you can see it play out throughout the world. So here in the United States, in New York in particular, it is the epicenter of the epicenter. We have thousands and thousands of cases. While we've hit a plateau, and what we mean by a plateau is that the number of cases is steady, that doesn't mean that we're not seeing more and more cases walking through our hospitals. We are actually seeing thousands of cases still walking daily to our hospitals. And we want to make sure that people understand we need to do epidemic control. So there are three main phases that we really need to focus in on. Epidemic control. therapeutic interventions, and then making sure that we have a good healthcare capacity. And right now, all these three things are playing out right now. When we talk about epidemic control, we need to make sure that we have good testing capability, a good testing infrastructure that is really lacking right now. We're ramping up not only here in the United States, but throughout the world. And then on top of the testing capacity, you need to isolate these individuals, do contact tracing. Contact tracing takes a lot of manpower. And then you need to quarantine those contacts. So each of these stages requires a lot of resources and a lot of manpower.
Likely die. That's why I do what I do.
You know, the critical question, Dr. Madad, is from your perspective, is this the worst? Let's start, for example, with New York City. Is this the worst that the world, let's take New York as an example, will see, or do you think that things could get a whole lot worse before they start getting better?
That's right. I mean, this is a worst case scenario. We have models that are here in the United States that we've been using. There's the best case scenario and the worst case scenario. These models had projected much higher fatality rates, along with a higher number of cases, a higher number of bed availability. And luckily, they were just predictions, and so they were proven wrong. And the reason why they were proven wrong is because we've been able to implement strong public health measures like social distancing. And so because of that, we're able to, reduce the number of cases, if you will. We're still surging very high. This is still a crisis situation. But right now, it's a very hard question to answer. Are we in the worst of it? We don't know, because this virus is still out there. This outbreak is only 4 months old. It's only going to continue, obviously, until we have a good therapeutic available, and that is something that is still being investigated.
What are you making of the different kind of responses, Dr. Madad, we're seeing globally? We've seen in Brazil, they've gone with the option of let's take the hit on the chest, we'll go in for herd immunity, whereas in a country like India, we've gone in for a complete lockdown. Which model are you recommending, and how do you compare the different responses we're seeing in different countries of the world?
So let's just take the two models that you obviously just set out. So first, when we talk about public health measures like social distancing, these are tried and true public health measures that have worked in previous outbreaks. So when you talk about SARS is an epidemic that took a year to ramp up to 8,000 cases, around the world. And we were able to get SARS under control, not by a vaccine, not by a therapeutic that obviously still doesn't exist today, but by good old public health measures, people being able to socially distance themselves. And that's how we were able to get that epidemic under control. And so those are, various measures that actually have worked, and they're continuing to work even now in this COVID-19 pandemic that we're in. When we talk about herd immunity, there's a lack of scientific evidence to show that herd immunity actually works. In fact, what you're seeing right now is that it probably plays a smaller role than we actually think. We're still doing serological testing. It's ramping up right now. We're not sure how prevalent it is in the community in terms of those that are immune to it. But even when we talk about immunity, what does that actually mean? Are you actually immune to the disease? Right now, this is still that's being investigated. It's still under, going through a scientific process to see, are you truly immune to COVID-19 once you've gotten infected? And right now, we don't have the evidence to show a definitive answer. Yes, you're immune once you get infected, or no, you're not immune. And everybody's body is different. Everybody's immune response is different. So you can't bank on herd immunity. That is something that has not been proven yet in this current pandemic. So it's dangerous to actually, move to looking at that particular aspect when we don't have enough information.
When we talk about another flu pandemic happening, it's not a matter of if, but when.
A new strain of bird flu.
This is definitely one of the most lethal influenza viruses that we have seen so far.
It just takes one person to start an
Now,
outbreak.
the other thing to look at, Dr. Madad, is what do you see happen from here? Do you think, for example, in a country like India, once the lockdown is over, people will be able to start resuming their life as it were earlier? Or are you of the view that what we're seeing in terms of social distancing, the problems that we're having to deal with, that will continue for a long time to come?
We are going to have to continue to socially distance ourselves for The main reason, the virus is still out there. So as long as the virus is still out there, it's going to continue to infect people. And in order for us to get that under control, we need to have various therapeutics available. And this is not a panacea, right? So even if we have a vaccine, that's not going to be a silver bullet. Even if we have a good therapeutic, it's not going to be the silver bullet. A lot of these things obviously are very beneficial, but we're going to have to see how well they play out. Right now, there's a number of clinical trials happening around the world for different therapeutics. I'm sure everybody has heard of all these different types of medications that are being, spoken on the media right now. There is no effective approved medication for coronavirus disease. A lot of stuff being done in terms of clinical trials, things that are looking promising, but nothing that has actually proven to be effective right now. When we talk about a vaccine, we're still at least 12 months away. It's going through a phased approach. So there's phase 1, 2, and 3. It's in a human, a lot of vaccines are currently in human clinical trials, but we're still a ways out. So between now and then, the virus is still out there. So we need to continue these social distancing measures. We need to continue these public health measures if we are to prevent a rebound. If we want to make sure that we're keeping everybody safe, if we want to decrease morbidity and mortality around the world, we need to make sure that we are following public health guidance until we have something more available.
What's your best sense about the strain of this Corona-19 virus? Is it mutating? Is it becoming more? Because a lot of things are being said, various theories being bandied about, but what's your sense? Is the strain from an epidemiological perspective relatively stable? Is it mutating? How are things changing? How are you seeing the strain of the virus change from country to country and within countries?
So these are viruses. Viruses are notorious for mutating, right? And specifically even RNA viruses. But luckily, what we're seeing with COVID-19 is that it is relatively stable, if you will. There's no dramatic changes to the actual strain itself. There are different strains, but luckily right now what we're seeing, right, based on right now observed observations, that it is particularly stable, yet we know that viruses obviously are notorious for mutations. So this is something that only time will tell. And as we gather more information, as we continue on with this outbreak, we're able to assess more from a genetic standpoint and see if things are going to continue to change. But again, remember, we're only a few months into this virus. This virus did not exist, back in, let's just say, October or so. There are different theories that this virus started in China sometime in November before everybody knew about it in December and January. But at the same time, this is a relatively new virus, and we're learning at a very fast pace about what this virus is, what it's capable of doing, and what needs to be done.
There was a report that came from South Korea which said that the virus had been reactivated in 91 patients. So somebody who's been studying this virus from the moment it hit the US. What does that mean to you, doctor? Because the sense that common people have is that if you get the virus once, if you've been infected once, you cannot be reinfected. So what does reactivation of the virus in somebody mean?
So I would be very cautious in reading those types of reports. So first, there's a difference between reading an article and reading a report versus reading something that's in a peer-reviewed scientific journal. So when you're reading an article, when you're reading a report, these are people that have no medical knowledge. These are authors that are putting together pieces based on, people that they've observed or different stories that they have seen. It's not based on science. It's not based on evidence. When we look at peer-reviewed journals, when we look at scientific studies, it follows a number of individuals over a period of time to prove a hypothesis. Right now, we don't have enough evidence to show that people can get reinfected and then have a worser outcome or whatever outcome that they may be. Right now, there are a number of different factors that are at play when we talk about potential reinfection. Maybe they're not reinfected. Maybe it's just the fact that they're still shedding the virus from being infected the first time. So there's a lot of different things that go into this particular topic. So I would just very much caution individuals that are tuning in to make sure that they are going to credible sources. Right now, on a global landscape, we're not only fighting the virus itself, we are fighting this contagion of misinformation. There's a lot of misinformation out there. There are a lot of people producing a lot of information, and a majority of it is actually not factual. It's not based on science. So you want to go to where the facts are, you want to go to where the science is, and that's very, very important.
What's your sense of how the race to develop the first COVID-19 vaccine is coming along. By when do you expect? How many months would it be in your view before the first vaccine comes out? There was a report that came from Oxford which said that some researchers believe they found a vaccine.
So there are a number of vaccines that are in the pipeline, and a handful of those are in human clinical trials. But vaccine has a whole process in place. You can't go through a rapid vaccine process because it may actually have a worse outcome. And what I mean by that is, first, there is a process in place to make sure that vaccine is effective and is safe. So there's 3 different phases, if you will. Right now, the vaccine that we're currently talking about, there are a couple that are in human clinical trials and through a small cohort of individuals. Once that's done, it's going to go to a larger number of individuals and see again if it's safe and effective. If you rush that, and if you have a vaccine available on the market, then you're going to potentially risk and do more harm than good, because we have seen that vaccines actually may have an opposite effect. So they actually may enhance your immune response, and this is something we don't want. So we want to make sure that it goes through the proper process. And right now we're looking at least 12 months. So I would caution anybody that says they have a vaccine. And again, a vaccine may not be the panacea. It may not be the silver bullet that we're all looking for, because there's a number of other issues besides a vaccine. You've seen in the docu-series, for example, the whole anti-vaccination movement. So even if a vaccine is available, we now then have to tackle the whole aspect of who can get vaccinated and are people willing to get vaccinated. So we want to make sure that while a vaccine is the golden standard, or we are trying to achieve that, it's still a ways off, but we're going to have issues once that vaccine is even available.
You're in New York City. You deal with the pathogens at the public hospitals there. What did New York get wrong? What are the lessons that New York can teach to cities in India and to our entire country about the mistakes we should not make, so that India doesn't end up in the kind of situation that New York did?
So this is a respiratory virus, and by its very nature, it is out to obviously infect as many people as possible, and it's through the respiratory route. And so we want to make sure from a global standpoint, all countries are prepared to deal with this type of virus. And one of the things that we know is that time is never on our side. So we want to make sure that countries implement these public health measures right away. So even in the absence of knowing that you have X amount of cases, you want to go ahead and make sure that you implement some of these public health measures, because this virus spreads very, very fast. And so a day or even a week lag can mean higher morbidity and higher mortality. And so we want to make sure these social distancing measures that have been proven to be effective, that we're seeing in the United States, because we're able to kind of flatten the curve, if you will, they are proven to be effective. So to start these measures sooner rather than later. And then very importantly, look at your hospital capacity and increase your hospital capacity. Here in New York City, particularly in the healthcare system I work with, we've been able to triple our ICU capacity in just a matter of a couple of months, which is astonishing, knowing that it can take a very long period of time to actually increase hospital capacity. We've been able to put makeshift hospitals, out in the field in a matter of weeks. And again, this is something that would take potentially months or years in a real timeline that we've been able to accomplish in a a relatively smaller amount of time. And then obviously looking at the staffing and the supplies that go along with it. You can have as many beds as you want, but if you don't have the staff to be able to man that bed and the supplies for the patient, well, that bed is not going to do any good. So you need to make sure you have all of these pieces in place, and you need to make sure that you do it rapidly, because this virus spreads very, very fast.
I started by asking you about the tele-series of which you were a part. I want to end by going back to that series, because it's very haunting. And how has it been for you personally the last few weeks? Because this is what you've prepared academically your whole life for. This is the role you essay in a series where you're warning the world about a situation, and just days after the series comes out, you're actually having to deal with that in real life. How has this been, Dr. Madad, for you personally?
It's been very, very exhausting, I can tell you, but I'm extremely proud of how our healthcare system and how our city has been able to respond to this unprecedented healthcare crisis that we're facing. You know, my work has been put into overdrive. It's almost 24/7. You know, there's a lot happening behind the scenes, a lot happening on the front lines. You know, I definitely want to give a shout out to our healthcare workers, our healthcare heroes, not just here in New York City, not just here in the United States, but all around the world, who are putting themselves at risk, but helping other people. These individuals are the true heroes, you know, who really are combating head on this virus that obviously no one has seen before. There's a lot happening behind the scenes, a lot of work that's being done, and it's only going to continue to, you know, we have weeks ahead of us, maybe even months ahead of us, maybe even years ahead of us. So we're in it for the long run. This is a marathon and it is also a sprint. And we just need to continue to do the good work that's being done all around the world.
Dr. Syra Madad, for joining us from New York City with your thoughts. Thank you very much. I can quite imagine just how tough the last few weeks have been, because this is what you really worked your whole life for, and that's the situation you now find yourselves in. We wish you all the best, to everyone in New York and those at the front lines trying to deal with this emergency. Thank you so much for joining us, and we hope that over the next few weeks we can have you back on our network to talk about the situation in New York and how you see it globally. For joining us on India Today, thank you very much, Dr. Syra Madad.
Hello everyone, this is Rahul Kanwal here. Hope you enjoyed this video. For the latest news and analysis, like and subscribe the India Today YouTube channel, and don't forget to press the bell icon to stay updated.